Technology can be annoying sometimes. Give me a headache. Okay. Yes, we can. I mean, it gives you a good surround sound experience. I try to focus as much into the mic as possible.
All right.
Okay, then. This is Smooth 98.1. Love music, love life. It's a feel good Friday morning, 30th day in the month of August 2024. You're listening to the Smooth Breakfast. Yours truly is Ayokunmi Kekiriako. And we're about to have a conversation, Lagos. This is where we get to have a dialogue, a back and forth. This is Lagos Talks on the Smooth Breakfast. Ayokunmi Kekiriako is my name. Great to have you on this ride because we're going to be having a very important conversation this morning. We always do. That's what we're all about. It's all about vision care this morning. Now, normally when we talk about vision care, we tend to talk about the adults on a very regular basis. We talk about eye conditions that adults have to deal with and so on and so forth. But we rarely ever bring the kids into the conversation because, yes, even children have issues where their eyes are concerned. We have a lot of kids these days at very, very young ages who are in need of glasses and so on and so forth. I mean, I started very young, very, very, very young. Well, not too very young, but young. Anyways, it's not about me. So we're having that conversation this morning, and we are talking about the importance of vision care for our children. It's all about clear sight and bright futures as well. I will be doing this all alone. Of course, I have a professional with me in the studio to give us clarity, break it all down, give us all the much needed information, and dare I say, advice as well on what we should be doing and what we should definitely avoid. Please welcome Dr. Chidinma Nwokedi-Onyejekwe. She is the Senior Registrar, Department of Ophthalmology at Lagos State University Teaching Hospital in Ikeja. Very good morning to you, Dr. Chidinma. Great to have you on
Good
Lagos Talks.
morning. Good morning, Ayo. I'm excited to be here.
I'm equally as excited to have you, really.
Thank you. Thank you so much.
All right. So as I stated earlier on, this is off the back of Child Vision Awareness Month, which is the month of August,
Yeah.
and it's actually interesting that we're having this conversation on the very last day in the month of August. So I would have felt really, 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 really unfulfilled if this could have been brought to the fore where this is concerned. So
Yeah.
off the back of what I said at the beginning when it comes to eye care, because whenever you hear about conversations that have to deal with the eyes, you're talking about, glaucoma in adults, cataracts,
Yeah.
this and that.
Yeah.
You rarely ever hear, the children, the younger kids being brought into the conversation. So it feels as if they are set to one side,
Yeah.
even though a lot of these issues, or sometimes these issues could manifest from the younger age,
Childhood.
from
Yes.
childhood, kids using glasses really young. I mean, I've seen kids who are really, 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 really young using glasses
Yes.
at that age. And I begin to wonder what exactly could have happened. And in some cases, some things don't even get caught
Yeah.
for whatever reason. So that is why we are here,
Yeah.
in order to give clarity and, of course, what should be what should be looked out for, what parents need to be aware of, what everyone needs to be aware of when it comes to eye care
And
for
children.
children. But let's start at the beginning. Could you just explain briefly the significance of Child Vision Awareness Month and why it's really essential for us to pay attention to vision care where kids are concerned?
Yeah. Thank you very much, Aya. So, Child Vision Awareness Month is important because it's supposed to highlight the issues that children have with vision and also to bring to the fore awareness that children can have vision issues right from birth up until they're adults. So children tend to be neglected because they're dependent and maybe they can't seek care for themselves. Unlike an adult that'll be able to talk, oh, I'm not seeing and all that. So child vision is important because the child may not be able to say, I cannot see or I'm not able to move around,
Right.
unlike an adult. So it's important for um, it's important for awareness to come up on the issues that children have with vision. Also, about 1.4 million children are blind worldwide, and three-quarter of this number is in developing countries, more in sub-Saharan Africa, of which Nigeria is part of. It's also important to note that when a child is blind, it's associated with developmental problems Okay, when a child goes blind, it has been found that every other part of the child's development is affected: mental development,
Hmm.
psychological development. Some children are abandoned; they just stay indoors. There's no social development. It affects their mental health. Childhood vision problems is also affected with childhood mortality.
Ah,
There seems to be a linear relationship with blindness in children and mortality, especially on the five mortality rates. So it's very important for us to talk about childhood vision impairments.
1.4 million kids. That's a scary number to think about. And
Yeah.
of course, the attendant effect, the domino effect of when these things happen, children getting abandoned and so on and so forth.
Yes.
That makes for very horrible reading or listening, as the case may be. So let's get down to brass tacks here. I mean, from your practice, your experience over the years,
Yes.
what are the most common vision problems in children that you've encountered that you can say, if you were to you talk about an average, the most common that you've
Yes.
seen, what are they?
Okay, so the most common would include what we call refractive error. Basically, refractive error is the error that is corrected by glasses. Okay, so the eye helps us to focus on objects to be able to see them. So in refractive error, it's either the focusing power of the eye is too much or the focusing power of the eye is not enough. So you
Okay.
need glasses to help you to focus those light rays more, in addition to what the eye will do, so that vision can be clear. So that is one of the common causes of childhood vision impairment. It's very common, and in this age where there is a lot of use of devices,
Mm,
screens,
mm.
there's by 2050, it's been postulated that one of the common refractive errors, which is short-sightedness, the prevalence is going to hit about 50%. So imagine,
50.
yes, in children, the prevalence is going to increase by 50%. So refractive errors is actually one of the causes of vision impairment. Other causes would include what we call cataracts. Um,
Even kids can have cataracts.
yes, kids have cataracts
Interesting.
even from birth. We have congenital cataracts that are present when a baby is born. So cataract is also a common cause, and it's basically when you look at the black part of the eye, there's something white, coming back to you. It's supposed to be clear and transparent.
Hmm.
So that's how cataracts can, appear. Then children could also have glaucomas, and we know that the vision loss that is caused by glaucoma is irreversible. So
That's
it's
right.
very important for it to be caught early in time. Children could also have childhood cancers of the eye. One of the common ones we have in Africa here is what is called retinoblastoma. It affects the retina of the eye, which is the part of the eye that sends information straight to the brain.
Hmm.
Children could also have what we call squints or strabismus in the medical term, or what in local parlance is called 4 o'clock eyes.
Well, that's the lazy eye.
Yes,
More or less
yes.
4 o'clock
So
eyes.
strabismus could eventually cause lazy eyes. Children could also have problems with their retina, genetic inherited problems. Children could also have what we call corneal opacities. Okay, so
Hmm.
the cornea is the black part of the eye, and in this part of the country, maybe in the past times, we had high incidence of corneal opacities because they come from measles and vitamin A deficiency. But now, with a wider coverage of immunization, we have measles and vitamin A deficiency reducing,
Right.
but we now have a lot of injuries, eye injuries in children. It's a lot now, tending to cause these corneal opacities or these corneal scars. Injuries from sharp objects, injuries from blunt trauma, different things. We have children that have eye injuries from pencils, biros, sharp objects at home. Some children are playing with scissors,
Hmm.
knives, bottles. Some children are flogged and the cane hits the eye. And these things actually cause children to lose vision. So these are some of the common causes of vision problems in children.
Wow. I mean, hearing that, kids could have congenital cataracts, as you mentioned, born with that glaucoma as well. I actually, was of the opinion of the thought process that, when you talk about glaucoma, and that's what we're talking about here. When we talk about glaucoma, I don't think anyone would normally think about a child. When you hear glaucoma, you probably want to hear, how old is he? How old is she? An
Yes.
old man, an old woman. Kids would definitely never come into the consciousness when that is actually concerned. And that brings me to my next question as to the part parents need to play in terms of the age that that their parents should get kids' eyes checked, and how frequently should these checkups be actually done? Because if you're saying a child is born with cataracts, how is that going to be caught? Would the parents normally at birth get the child's eyes checked? I mean, how does it work usually?
Okay, so at birth, I mean, the normal practices for the nurses and the midwives and doctors that take the delivery to just have a general look at the child to make sure that
Okay.
the child is well, there are no structural abnormalities. And one of the things that should be looked at is the eye. So the health practitioners can actually help to look at the eye. But going forward, there are specific things to note in vision development in children. At birth, a child should be able to react to light. That is, when you bring light to the child's eye, the child should blink to
Mm,
light.
mm.
Um, and with time, in the next 1 month, the child will be able to fixate on an object or look at the mother's face. So
Okay.
the
Okay.
mother should be able to tell, okay, I don't think my child looks at my face. Um, I'm breastfeeding, and you know,
Child is not focused.
yes, the child is not focused. So the child should be able to fixate on the mother's face, and going further, when you bring an object, the child should be able to look at the object and follow the object if you move it around.
Mm.
By the time child gets to 6 months, 7 months, 8 months, 9 months, the child should start reaching out for objects. Those are all indicators of good vision. So I think that if parents know these things, they can be on the lookout for when problems begin to occur. And of course, as the child gets into preschool age, school age, starts reading books, starts doing assignments, you should be able to know if your child is actually seeing well or not. So,
Right.
vision screening should start from birth, okay, and should be done as often as possible when the child is making major milestones. Um, I know that when children go for immunization, the nurses are also trained in those immunization centers to be able to pick up any problems with vision. Um, and then some schools do what we call school vision screening,
Okay.
especially when the child is about to enter school. So those are timelines that children can have vision tests at birth, when they begin to go for immunization, between 0 to about 2 years, when they
Okay.
get into
Okay.
school at the preschool age, um, when they get into main school age from 5 years, and going forward before secondary school too. Some schools, most schools actually incorporate school vision screening. So if all this is followed, I think vision problems can be caught on time.
Hmm. It's all about being vigilant and keeping literally our eyes open to see what's going on with the vision of our children. As Dr. Chidinma has said, there are
Yeah.
certain points where very keen observations need to be made. And man, this is all very interesting. This is why knowledge is power, as they say. You learn every day. And we're going to learn a whole lot more on the other side of this very quick breather right here on Lagos Talks Smooth 98.1. Don't go anywhere. Kids can have cataracts and glaucoma. Hey, there's problem in the land.
They can.
That
But
is
then,
interesting.
because people think they cannot, they'll keep saying things like they're going to outgrow it.
3.
Right?
The
Yeah, so those
opportunity
that's one of the
window to
common
invest in
problems
the
we have,
domestic
especially in Nigeria.
FGN US dollar
You know,
bond
they keep
ends
saying,
on
oh,
August 30th,
even when you go to the
2024.
hospital
That's today.
sometimes,
Don't miss the
because
chance to
eye
be a
health
part of something
is
greater and potentially
subspecialty.
earn higher
Not
returns. With a
everybody
minimum
gets,
investment of
even
$10,000,
during your medical
you
school
can
training, you have
participate.
just
And here
one
is
week
how.
of
Step
exposure to
1. Visit
in the nurses. I'm not even sure if they really have been exposure.
Wait,
www.dmo.gov.ng to
are
download
you
the
saying like
subscription
for
form. Or you can
general
get the form from
medical
any of the
practice,
issuing
not
houses, either
specialty?
United
Yes.
Capital,
So some
Meristem
people even
Capital
go ahead to
Limited,
tell the students
Stambic
to wait till
IBTC,
their 1 year,
or Vertiva
wait
Capital
till their
Management
two
Limited.
years.
What for what?
Step 2. Fill out the
It is going
form
to
and pay via
it's going
wire
to
transfer to
go. It's
any
going to
designated
resolve on its
receiving
own.
bank account as seen in the pricing supplement. Step 3. Submit your completed
Interesting.
form and payment proof physically at any issuing house or electronically
Hmm.
at any of the receiving banks. This win-win opportunity is only open to Nigerian residents, Nigerians in the diaspora, Nigerians with savings abroad, and institutional investors. Don't miss out on your chance to invest in something valuable for yourself and for our economy. Consult your bankers and financial advisors today to learn more about the domestic FGN US dollar bond. Smooth 98.1.
Okay, let's jump back in.
The Smooth Breakfast Show.
Welcome back to Lagos Talks on Smooth 98.1. Love music, love life. This is the Smooth Breakfast. It's a feel good Friday morning. A great time to have a feel good Friday morning sort of conversation. My name is Ayokunmi Kekiriako. Welcome along to the ride. We've been having a great discussion this morning. We've been talking about vision care for kids, vision care where children are actually concerned. It's all about brighter, a clearer vision, a clear sight, and bright futures as well. And my guest this morning is Dr. Chidinma Nwokedi-Onyejekwe. She is Senior Registrar at the Department of Ophthalmology, Lagos State University Teaching Hospital as LASUTH, right here in Ikeja, right here in Lagos. Welcome back to the show, Dr. Chidinma.
Thank you.
It has been for me. I mean, in the last 20 minutes or thereabouts, it has been a very eye-opening sort of discussion. I mean, I've heard things from you that I did not know were possible, but clearly they are possible. That is
Yeah.
why it is important to talk to those who are in the know
Yeah.
to better understand and not assume
Yeah.
and all that. And for all our wonderful listeners out there, you can join the conversation this morning. You can share your thoughts or even any questions that you might have for the good doctor. She will do her best to answer them and give you some clarity. The WhatsApp number is 0809 440 981. 0809 440 981. That is the WhatsApp number. You can also join us on YouTube where we're streaming live at Smooth 981 FM Lagos. Smooth 981 FM Lagos. All right, so let's get back into the conversation and talk about early warning signs. I mean, you
Yeah.
alluded to some earlier, but let's kind of, should I say, peg this if we can. Let's talk about kids who are, let's say, a year old, 2 years old, who are
Yeah.
already, active, turning the house upside down,
Yeah.
and who can, to a degree, express themselves in
Okay.
terms of, oh, I'm feeling like this, or I can't do this, or I can't, do that. So where the parents are concerned, or even those who are around them, caregivers and so on and so forth, what are some of those early warning signs that the parent should look out for, the teacher should look out for, regarding potential vision issues in the
In the
children?
children. Okay. So some early warning signs the parents should look out for, like I mentioned earlier, when your child is not doing what he should do as per vision wise. Okay, you notice that the child is bumping into objects. You
Hmm.
notice that the child has a preference for one eye. He wants to look at something. He will rather use one eye, maybe tilt his head
Okay.
or go
Okay.
closer. Those are pointers. Then you also notice that maybe the child's eye is growing bigger than normal. We have
Hmm.
people that will say, "Oh, we have big eyes in the family." I mean, a child was not born with one eye being so big, or it was born with the eyes normal, and then in the next 3 to 4 or 5 months, you notice an abnormal enlargement in the eye, or that's a pointer, especially to childhood glaucomas.
Okay,
Glaucoma in
okay, okay.
children, they don't have the same presentation as in adults. They would have the eyeball enlarging, growing big. We call it bullseye in the medical parlance.
Huh.
Looks like a bullseye. And then the child will also be watering from that eye. He's not able to look at light. Basically, the pressures in the eye are so high that the pressures are
Hmm.
enlarging the eyeball, causing the eyeball to tear. Another pointer that parents should look out for is a whitish reflection from the eye. We call it the cat eye reflex, just to simulate when you look at the cat in the night, there's a reflection that comes from inside the eye of a cat. That's normal for the cat, but in a child, it's a pointer to something happening, either cataract or even the more sinister cancer of the eye called retinoblastoma. So when you look at the black part of the eye, it's transparent. You shouldn't have any reflection coming back to you. But when
Okay.
there's cataract, when there's retinoblastoma, there will be a white reflection coming, out of the eye into the eye of the person that is looking at the child. Other pointers include when the child's eye is deviated. Okay, what we call 4 o'clock eyes. It could either be deviated outwards or it could either be deviated inwards. It could mean
Okay.
that the child needs glasses, or it could just mean something else. When an eye is deviated, it means the eye is becoming lazy, like you said earlier. And if a lazy eye is not attended to on time, by the time the child is 7, 8, 9, 10, especially if the child needed glasses, it may be difficult to correct that lazy eye. The eye becomes lazy because the brain ignores signals. The brain is trying to focus to see. And,
Hmm.
you know, when it sees clearly, it helps the development of the brain. But once the vision is not clear, the brain is struggling to see. At some point, it like ignores vision. Oh, I can't see, and then the eye is like, I can't see too, so I'm going to stop looking straight. I'm just going to turn outwards and become lazy. So that's what happens. So that's also a pointer.
Okay, let me just interrupt you briefly here. Now,
Yeah,
when you said the brain just ignores that eye and says, "Well, I can't even be stressed."
yeah.
So does that eventually mean that sight could be lost in that particular eye?
Yes, sight could become subnormal than what it was supposed to be. Okay, especially if
Hmm.
the deviation was not attended to on time. When the eye is deviated, it could either be that the child needs glasses, so the child needs to see, like I said earlier, and the eye is not focusing properly. The child struggles, strains, has all the problems of eye strain, headaches, and double vision. The brain is trying to, understand that stimulus, but at some point, it will not continue because the stimulus that is coming to it is not a clear stimulus.
Hmm.
So it is going to become lazy and either turn out or turn in, whichever way. So that's another pointer. Other pointers would include when the child's eye is red, don't just ignore it and say it's Apollo, what we call Apollo. Okay, redness of the eye could be anything
Right.
beyond Apollo. When the child's eye is watering, when the child's eye is discharging, those are all pointers to vision problems. So I think these are some of the pointers. Then for teachers, you mentioned teachers, they should take note of children that need to move very close to the board to see. Some of them won't even move close to the board. They will just stay at the back and you notice they are not participating. Some children will have other of their classmates write notes for them, okay? Or they would prefer to, at the end of class, take the child's notes and just put it at a very close distance and
Hmm.
copy. So
Hmm.
teachers should take note of children that do not just want to copy the blackboard or the whiteboard in class. They shouldn't think that, some people would start saying, oh, this child is lazy, this child is not serious. It may just be that the child has vision problems. So that's
Right.
also a pointer for teachers.
Right. You know what? That last point you made about teachers, it's exactly how I got to where I am right now. Wearing glasses. Shout out to my teacher in primary four, then Mrs. Inkem, wherever she is. I mean, she was the one who noticed that I was struggling
Yeah.
in class. Always going close to the board. and all that. And she made it her personal mission to speak to my mom about it and said, this boy is he's always coming close to the board and all
Yeah.
that. I think you should take a look at this. And lo and behold, I did need glasses. And yeah, since then I've been on that journey and here we are. All
So that's
these
a proactive
all these
teacher, thanks to
exactly,
her.
exactly. That is the sort of thing that we need from those who are taking care of these kids, either at home or at school or wherever. It's
Yeah.
it's a collective. It's a collective effort because most times these kids won't even say anything.
Yeah, they
They
won't.
won't. They'll just keep on living their life in a certain way. I mean, if they can't do the thing what they do normally, they'll find another way, deviate and
Yeah.
do it that way without
Yeah.
expressing that something is wrong.
Yeah.
This is hurting. As long as they can find another way to do it, honky dory for them. Bless their hearts. But anyways, let's talk about the healthcare system in Nigeria. I know that where doctors are concerned, this is a very contentious issue, all the back and forths and so on and so forth.
Yeah.
But they need to be spoken about really. Um, how do you think the Nigerian healthcare system is performing in terms of providing adequate eye care services for children? Now, I know that for adults, it is a huge deal because when I used to follow my mom for her eye appointments in Lagos Island here, we would leave the house super early. We'd get to the eye center and it would be like Balogo Market, 1,010,000 people already waiting, and
Exactly.
that's adults.
Yeah.
So where kids are concerned, I mean, what is it looking like?
Okay. So for the Nigerian government, um, they have done fairly well in some areas, but more still needs to be done.
Hmm.
Like I mentioned earlier about wide coverage of immunization has helped to reduce some of the problems that were plaguing us in the past in Nigeria, which include vitamin A deficiency, which causes some form of corneal blindness, and
Okay.
measles, which also causes some form of corneal blindness. So widespread immunization coverage, training the nurses and the community health workers in the primary health care centers have helped. These people have been able to give immunizations, train mothers, teach mothers about fortification of food with vitamin A, fortification of
Mm.
food to enhance vitamin A intake in the child. And then we also have a lot of health policies, national eye health policies that have
Okay.
been formulated by the Federal Ministry of Health to help vision problems in general, which would address both adult and children vision problems. Um, but in going to the other side, we still have problems with availability of
Mm.
health, eye health facilities. You know that eye is like a very, it looks like a small subset, but it's actually something big. So we still have problems with availability of facilities, availability of manpower
Okay.
for we need what we call pediatric ophthalmologists. Okay,
Ah.
we have ophthalmologists, fine, but we also have a subspecialty called pediatric ophthalmologists. Okay, so these people are very much present, but we don't have enough to cater to the needs of children. So availability of facility, availability of manpower, and when these facilities and manpower is available, sometimes it's not accessible. Sometimes you have to refer people to another state,
Another state entirely.
yes, to get proper eye care. Okay, so I mean, when a mother has to go with a child to another state, imagine what happens. She may not follow through because she just left with one of her children. The other four are at home. They need motherly care. She needs to do things for them. By the time she gets there, and like we all know, it's not going to be a 1 day thing. And they tell her, come back in 2 weeks, come back in 4 weeks. She's just going to take her child back home and
Mm.
probably take her child to the neighbors who said, oh, we know this place, we know this eye drop that you can use. So accessibility, and then when it's accessible, sometimes it's not affordable.
Mm.
So
Mm.
Nigerian government can do better in terms of health insurance packages, ensuring that this national health insurance gets to the grassroots, gets to to everybody. Okay, equity. Even the people in, the very hinterlands can get,
Right.
this health insurance package and use it to assess care so that they are not paying out of pocket
Mm.
as we have presently. So those are areas that can be worked on. Thank you.
Interesting thoughts there. Now, I'm going to hold on really, really tightly to something you said about, the parents who might go to the neighbors and they say, oh, there's one eye drop we know. Oh, there's one leaf we know you can rub on the eye.
Yeah,
I'm going to hold on to that because when we come back in after this quick break, I'm going to talk about cultural beliefs.
exactly.
And of course, all those people that say, like you said, he will grow out of it, she will grow out of it.
Yeah.
We'll talk about that and a whole lot more. This is Lagos Talks on Smooth 98.1. We'll be back in a bit.
Thank you.
It's a smooth 98.1. Don't go anywhere.
Interesting. Interesting. What's I mean, kudos to you, doctors. You guys are doing a yeoman's job. I mean, despite the serious limitations
Yeah.
that there are, everybody has left,
Everybody has
has
left.
gone. And then you're talking about a subset to ophthalmology, pediatric.
Yeah. So these are, I mean, these are areas that can be explored, and that is only our starting point. All the people are doing a lot of things. They're already talking about genetics, identifying diseases that have to do with genetic mutations,
Mm,
offering genetic counseling, because some of these childhood diseases are genetically inherited.
right,
And
right, right.
when it's a problem with the gene, there are some of them that just cause blindness. We have a lot of childhood diseases that are as a result of genetic mutations that
Nothing can be done about that. It's automatic.
is automatic. Even though it's, well, maybe because we don't study it, but it's not so much of that in developing countries. It's more in the developed countries.
All
But it's
380
gradually
games are
coming
about to
here.
come alive
We
on your
don't yet
mobile
know the
phone.
body
Step into
because
the
maybe
Premier
we haven't
League
enough
with Showmax.
experience with,
No matter where you are, your favorite teams are just
so
a
these
tap
are
away.
things that we done,
Sign
areas
up on
that
the
we
Premier League
explored.
plan on Showmax.com.
Government
Create your
has
account,
tried
download the Showmax app,
where
and
on
stream the
things
Premier
that
League
has to
for
do
only
with children,
3,200
when
naira right
diarrhea was
on your
killing
mobile.
children,
It's your
malaria,
stadium on the
but
move.
we can take it
This
a
is IDK
notch
Space Your
higher.
Boy,
You can
and
do
this
better.
is your breakfast show on Smooth 98.1.
If you're just tuning in, this is Smooth 98.1, your love music, love life station. On a Feel Good Friday morning, we're having a conversation on Lagos Talks. My name is Ayokunmi, and it is all about vision care for the kids this morning. It's a health sort of Friday morning, talking about how important it is to focus on the vision of children, vision care, and hey, from what has been said this morning, so many things can be nipped in the bud right from the very, very early stages, if only attention is paid to the signs. And of course, a lot of practices are thrown into the dustbin, not even the dustbin, the trash compactor. Shouldn't be the dustbin at all. But anyways,
Yeah,
welcome back to the show.
thank you.
My guest is still with me in the studio in the person of Dr. Chidinma Nwokedi-Onyejekwe.
Yeah,
Uh,
thank you,
the,
Ayo.
yes, 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 and it is very, very, very insightful what we've discussed up till this point. And for our listeners out there, join us on the conversation, share your experiences as well, or any questions you might have. The WhatsApp number is 0809 440 981. You can also give me a call on WhatsApp if that is more convenient for you. Also, the studio line is 0201 4489981. 0201 4489981. That's the studio line to give us a call on if you'd love to have a conversation with us and with Dr. Chidima in the studio as well to just get clarity on maybe certain things that you have. So those are the avenues. Also, YouTube is there. We're streaming live, Smooth 981 FM Lagos. Let me get back in with the message here. This is coming in from Ian. First part is a funny one, and he's surprised that I wear glasses. Ian, clearly you haven't been checking us out on social media. If you have, you would have seen all the antics there and that I do wear glasses. This radio is so interesting. It forces you to paint an image of the people whose voices you hear over the radio. How interesting it feels to learn how wrong you might be. Well, Ian, that's why we learn every day.
Exactly.
I should charge you for that. Then he further says, shout out to the doc in the room. Very interesting talk show this morning. And he says that he was reading about something on the internet just this morning.
Yeah.
And the doc, like he was listening to, said some massages in some pressure points in the body can help the eye. Is there any truth in this?
Hmm. I I don't know about that. I do not think that it is true. If we go by scientific facts, because you know that we're doctors and everything we do is evidence based. I
Right.
haven't heard of massage on some pressure points helping the eye. And a lot of people are actually online calling themselves doctors, so we need to be careful of who we listen to and what content we take in.
Hmm.
Thank you.
Mm, thank you very much for that, Ian. I hope that actually helps. And I'm glad you asked that question, Ian, because before we went on that break, I said that we're going to come back in and continue on the trajectory of, discussing cultural beliefs and those behaviors, practices that a lot of people tend to, should I say, get themselves into.
Yeah.
As we alluded to earlier, oh, go to the pharmacy, let's go and buy this eye drop and use. Oh, there's this leaf behind my house. Rub it on his eye, rub it on her eye. She'll be fine,
Yeah.
and so on and so forth. Now, those are some from your experience. I'm pretty sure you've seen a lot
Yeah.
of things. So, what are those specific cultural beliefs or even stigmas as well in Nigeria that hinder parents from seeking eye care for their children? And
Okay.
how can we overcome? We need to overcome.
Okay, so well, the first one, like you just stated, use of what we call harmful or traditional eye medications or harmful traditional eye medications. Um, these harmful medications are actually coming to the fore when you talk about causes of vision problems, especially in children.
Mm.
Okay, so we have people use the child's eye is red, and then someone says, put urine in the eye.
What?
Urine is like
It's a waste
basic.
product.
Yeah, but that's what
What?
most people use. And the information just
Ah,
passes on, and then some people say, yes, I used urine and it worked for me. Now, like I said, redness could be anything.
true.
Sometimes it could be just a viral cause, and we know that in most viral pathologies or most viral diseases, they tend to resolve on their own. So when the eye gets clear, the person says, oh, I used this urine and it worked for me, and you should use it. So people put urine, people put mixed salt in water in their eye. Imagine the concentration, the
Hmm.
hyperosmolarity of that solution. People put sugar inside water and put in their eye. People put onions. People put palm oil. People put mentholatum, seawater. Just like you said, they mix leaves and they use it on children. I ask people, if they use this thing on your eye, just the first drop, you will run away. Well, because that child cannot talk. That child
Mm.
is dependent. That child is relying on anything the mother does.
Right.
So they just keep on applying it and applying it. And by the time they're coming to us, a lot of damage has already been done. So these medications have this well, we call them medications. They're very harmful to the eye. How can we curb this menace? I think from health education, awareness, we need to do a lot of health education, probably even show people the eyes of people that have been damaged by using these things. The eye is a sterile structure. It's sterile,
Okay.
it is clean. It doesn't have any microorganism naturally. Okay, it has a particular concentration. So when these things enter the eye, they either introduce microorganisms or they destabilize the what we call the pH of the eye,
Mm.
the acidity or the alkalinity of the eye, as it may be, and they damage the structures beyond what could be repaired. Okay, another myth or things that people do or say is when it comes to children, you have a child that is born with a cataract per se, then some people will say, oh, just let him get to 1 year or let her get to 1 year. the child is going to outgrow it, or the pathology is going to resolve. There is I don't know of any eye condition in children that actually goes away on its own. So it is that myth should be just dispelled. Another myth or another cultural belief is that children should not wear glasses, or children do not wear glasses. You have parents, when you tell them that your child needs glasses, they will go ahead to say, God forbid,
Of
he's too
course.
small now. He's just 1 year. He's just 6 months. He's just one and a half. He's just 2 years. You know, people just have this belief that glasses is for adults. Okay, but wearing glasses is, I mean, I think it's one of the easiest things, one of the easiest pathologies of the eye to treat, the refractive errors that need glasses. So, if a child needs glasses, please let him or her wear that eyeglass, because by the time the child comes of age, maybe they get to 13, 14, and they start pushing their parents, Mommy, Daddy, take me to the hospital. I want to see the doctor. It may be late.
Hmm.
And vision problems actually destroys a child's self-esteem. Like I said earlier, it affects their psychosocial development. They get to class, they cannot see. Some of their classmates will even say, ah, this one, he can't see what we're doing, just leave him out of it.
And kids can be
Yeah.
very mean.
Yes, kids can be very mean. They don't even know what they're doing. you know Everything the child is supposed to do naturally, he's not coming forward because he knows, I can't see it though. I may have to go very close, or even if I go very close, I will not be able to see it. Another myth is that there are some things that are inherited, like I talked about children having enlarged eyeballs, and somebody says, in my family, we have big eyeballs. I don't know. There's nothing like, well, yes, big eyeballs could actually run, but you should note the change. You have a child that has a normal eye, and all of a sudden it starts growing big. Maybe one eye is even bigger than
And
the
the
other,
other.
and you keep saying the child, we have it runs in our family. Same thing with what we call 4 o'clock eyes or deviated eyes. They say that it runs in the family. It doesn't run in the family. It could be a pointer, like I said, it could be a pointer to an eye cancer. Now, the thing about cancers of the eye, if they're not attended to on time, they can go from the eye into the system, into the brain, into the blood, and a child can lose his life. We've seen children lose their life just from having eye cancers. And these eye cancers start very small, as something white, and it is ignored, and it goes to get into the brain, get into the system, and destroy the child. So some other um, myths that maybe I haven't said would include, um, well, I think I've said everything. The common things that we do or
Hmm.
we say here, cultural beliefs, breast milk, you know, people use breast milk in the eye a lot.
Wait. Hold on. Hold on. Back up here a bit. They take a mother's breast milk
Yes,
and apply in the child's eye.
yes.
So it has to be breast milk specifically.
Well, there is this
Or
notion that breast milk does wonders. I do not disagree with it. Yes, in when it goes into the mouth of the child and goes
eh,
into the body.
eh,
But there's an extended use of breast milk for different things, for wounds. In mom communities, you see people talking about breast milk, and they also get to use it in the eye too. Put breast milk in the eye. So, and this thing is passed. I mean, your mom comes from Mugo, and she's like, this child's eye is red. Please let's put breast milk. Please let's put. And you're trying to hassle with her. She's like, no, I did it for my 5 children. And that mom too, she learns it, and she'll go and she'll teach her, children. I'm a young mom. Okay, I belong to a lot of mom communities, and people still talk about. I mean, my contemporaries still talk about using breast milk in the eye.
people, we need to unlearn, relearn, and so on and so forth. A clean reset, because why? We'll take a quick break right here when we come back in. Lagos Talks, and of course, the final leg of the conversation this morning. Don't go anywhere. Stay with us.
Thank you.
Why?
Thank God I remembered breast milk. It's a very common one.
See how I'm using corner eye to look at you. I should keep pressing star 321 hash on your phone. It's that
They
you want
don't
to
only
borrow
use it
from
on
me.
the
Yes,
eye.
now.
If a
What
child has
happened?
a say this breast milk, it
Where
has
have you been,
healing
girl? Star
properties.
303
It
hash
has
is the
this
new
Hey,
code to
properties.
borrow credit and data on
hey,
Glow.
lack of
See the
wisdom.
code to star 321 hash. But
And you're
star
just
303 hash.
introducing something of a
Confirmento.
different
What's up?
concentration
It worked all
and
before, girl.
solution
Star
into the
303
eye.
hash. Not before show.
That sounds
But
absolutely
guy, I want to the data
ridiculous.
where you borrow. Go reach me and you.
I don't even know
Star
which is more
303
ridiculous,
hash.
that or urine. I'm not sure which is more ridiculous.
Early
I
morning
honestly.
urine.
Unlimited.
And then after all the damage has been done, you not start running to the hospital.
Exactly.
Why did you run there at the beginning?
How you're from across 1,000 tongues that all speak in one voice.
It's very
Welcome. How you can wake up with one foot firmly
so our
planted in
health
the
seeking
Indian Ocean
behavior
and the other
generally
in the Atlantic
is
Ocean.
poor.
How diamonds in
Okay.
couture
The
about a
the
stone's
myths
throw
and the
away
generational
from a safari.
stories aside,
How your tongue
is
will
the
visit a
fact
million
that people
destinations on
deem
one
it as
leg.
expensive. Is that a big
How your
part in
feet will
why
sway
they are
in
so
blending, your
reluctant
torso
and they
in
always
piano,
go as a
No,
last
your mind
resort?
I don't
in
think so.
bliss. How crystal clear rivers
Our
flow in the day
some
and crystal
some of these eye
flows in the
diseases
night.
just come may just be one eye drop
We
of
know this because this is
one
how we
five
South Africa
2,000
every
naira that you
single
need.
day. And this is
You
why
may not
we
need to
invite
come
you
back for
to
follow up.
South Africa with us.
Hmm.
So come
Especially
see,
the redness
touch,
of the eye.
taste,
It's
and
when a child's
feel
eye is
South
red that they
Africa.
tend to put so
Come
many
journey with
things.
us.
So
Okay.
the initial thing that makes the eye red may not even
www.southafrica.net and see for yourself.
cause it's not supposed to cause a problem. So it just may require one hospital
You're
visit,
tuned
one or
in
two eye drops. So
to
by
the
the time
quiet
you use all those things,
storms
so it's not really the
our
cause.
way.
You just have a poor health seeking behavior.
Zoom in to the best of
When we get to the
Smooth
hospital, we are
R&B.
not patient
Disco
with the
R&B and
process.
transitional
You know,
artists.
Nigerians just want to come
Singing
and
and
go
melody,
back home
lyrics
immediately.
that mean
You
something.
know, you have to be patient in the
Serving
person with
music
the person.
all night.
Anywhere in the world,
The smooth
True.
queue for services.
True.
On Smooth 98.1, Mondays to Thursdays from 8 p.m.
All right, we're in the final moments this morning on Lagos Talks right here on Smooth 98.1.
Yeah.
Love music, love life. My name is Ayokunmi. If you're just tuning in right now, you catch the last part of the conversation, but you can always go back to the entire show on YouTube. We're streaming live there at Smooth 91 FM Lagos. You can also send your messages in on WhatsApp if you have any questions to ask the good doctor with me in the studio, Dr. Chidinma Nwokedi-Onyejekwe. WhatsApp is 0809 440 981. You can also sneak in a call or two if you want to ask a question directly or make a comment or two. You still have a couple of minutes to actually do that one. Okay, now, Dr. Chidima, let's begin to wrap up this very eye-opening, no pun intended, conversation
Thank you.
that we're having this morning. Now we talked about the role of teachers earlier on in terms
Yeah.
of how they can also play parts in catching some of these eye vision issues really early. But
Yeah.
I want to come to that, and I want to ask you, what roles do schools in general, the teachers also, what roles do they play in promoting eye health among children, and how can they better be supported in this cause? Because we know that in many schools, the schools are already dealing with
So many
so many
things.
things, and then like, I can't be stressed with this one.
Yeah.
But these kids are within your walls for a good part of the day. So
Exactly.
a lot of things that would happen to them or they'll experience, they'll be caught by you, more or
Yeah.
less. So what do you think can be done in order to better, should I say, support and equip schools and teachers in general when
General.
it comes to eye care for children?
Yes. Yes. So school vision screening is actually something that has been done in the past and is still ongoing. Um, they make use of what is called vision corridors, basically just putting a chart. There's an eye chart that is used to assess vision, basic vision. Putting
Okay.
a chart maybe in the hallway, in the corridors of the school, and children go to read those charts maybe at different times of the term, at the beginning of the term, midterm, and other times, maybe at the end of the term when there's no schoolwork. So
Okay.
that's one way. I don't know if schools are still doing it, but I know that it's one of the policies that was introduced when we're talking about Vision 2020 and enhancing vision generally in
Mm.
general population. Okay, so that's one thing. If the schools are not able to do that, they can insist on having children screened before resumption or before the child gets into school initially. I know some
Okay.
schools will send you for general tests, blood tests. So vision screening should also be included in these tests that the schools send children to have before they come into the school. Like you said, the teachers are sometimes overwhelmed, but we could also have training for teachers, maybe organized by the government, by the Federal Ministry of Health, by the
Mm.
local governments. Just basic training on things to look out for so that they can be, because children spend about 8 hours
In
with their
school
teacher in
every day,
school,
yeah.
yes. So, and how to, pick up vision problems on time. I said it earlier, a lot of children not doing well academically have vision problems and it is not picked up. The general notion is just that this child is a dull child or this child is not serious or the parents are not serious, so they should teachers should be trained on all these pointers to poor vision in children.
Okay.
And then a lot of eye injuries actually happen in schools. Flogging, we have a lot of children that have lost vision, you know beyond repair because they were
Hmm.
being flogged by their teachers at school and the cane mistakenly hit the eye. So teachers should also be taught and trained about safe eye practices in school. If you have to flog a child, please flog below the waist because the eye can go. Some children are trying to remove their hand,
Mm.
trying to dodge the cane, and then the cane hits the eye. Safe eye practices would also include children should not play with their pencils, biros,
Any sharp point,
outside. Yes,
any
any sharp
any
objects.
pointy objects.
Yes, but in school it's mostly the pencils and the biros that cause eye injuries. So outside the
Hmm.
time of usage, they should have their pencils and biros kept, especially primary school children. Those are the ones that are learning how to write. They are eager to scribble, in between time. So teachers should be taught about safe eye practices. Um, these are short trainings that could be done. You can
Okay.
even just do it for the school directors and they go and pass it down to their teachers. You don't have to
Right,
call all the
right,
teachers.
right.
Information is something that can be passed down. Yeah,
Interesting.
yeah.
Very, very interesting. I'll take a couple of messages and, of course, ask you two questions I kept in my back pocket. And I'm very curious about it. But I can't have you here and not ask those questions. I'm very curious.
All right.
Deji says, I'd like to ask the doctor, what do we do when exposed to tear gas? Huh. Almost every morning, the police station behind our house release tear gas, and we have to scramble to close the windows and doors. We have kids in the house, and it's a battle to help them see properly. Thank you.
Hmm. Okay, so first of all, like he has already said, taking the children out of, or everybody out of the reach of the tear gas. But if anybody or a child per adventure is closing the eye, or it looks like that tear gas has really caused some eye irritation,
Mm.
you can quickly use running water because what the tear gas introduces is just chemical substances. So you can take the child under running water,
Okay.
clean running water, and just irrigate the eye thoroughly. But please,
Okay.
prevention would actually be better.
Prevention will be better.
Yeah.
Water saving lives since time immemorial. Cisco Delgado says, okay, Cisco, I don't know if you caught this part of the conversation. He says, what's the implication of putting breast milk in babies' eyes? My wife is doing this to our newborn.
Yeah.
He further says, I always take precautions about my kids playing with sharp objects with regard to their eyes. But this issue about breast milk, we literally discussed this, and I thought it was a hoax, even though the good doctor said so. But I mean, do you respond to Cisco Delgado here? I mean, he's asking about the implications. We talked about maybe he missed that, but
Yeah.
please let him know the implications of doing that.
Okay, so breast milk in the eye, breast milk comes at a solution that is not compatible with the eye. Yes, it may not cause anything because I mean, when you put it in the eye, maybe you put a little drop, the child blinks, it's quickly absorbed, but you can never tell. We have people that have had eye problems and they're using breast milk and the eye problems get worse. So the implications include, if it is because of redness that the mother is putting breast milk, the the pathology or the disease condition that is happening in that eye can get worse. It can
Right.
affect the black part of the eye and cause what we call an ulcer or a wound in the black part of the eye. And when you continue using the breast milk, that ulcer would keep on enlarging and it can eventually cause what we call an opacity, a whitening of the black part of the eye. At that point, the only thing that can be done is what we call a corneal transplant. And I mean, I know that this is something that has been passed on, and people are doing it because sometimes, most times, more often than not, or average of the times, it may not cause anything, but it is not good. It is actually harmful.
It's not appropriate.
The eye, there are required eye drops that have been made. They have followed specific concentrations and doses and have tested it on, first of all, animals and rats before they test it on human beings to ensure that it is safe to the eye. So using anything outside these approved drugs, of course prescribed by an eye doctor, is not good. Thank you.
All right. Just gonna hope that actually answers your question. And he says, "Thank you, doctor. No more breast milk in my baby's eye."
Exactly.
Oh my goodness. Okay, we need to run, but those questions I need to ask you
Yeah.
really quickly in about 20 seconds.
Okay.
Carrots.
Mm-hmm.
Does it do anything for the eyes? You hear people saying, eat carrots, eat carrots, eat carrots.
Yeah.
It doesn't do anything for the eyes.
Okay, so carrots are a good source of vitamin A.
Okay.
And vitamin A actually help in the lining of the eye, a healthy lining of the eye. Vitamin A also is also important in the retina of the eye.
Okay.
Now, if vitamin A, when used, actually improves vision, if there is a pathology, it has not been researched and there's no logical conclusion.
Okay.
Yes, we should eat healthy because it's not just for our eye, for every other part of our body. But for children, because children naturally do not have the high stores of vitamin A like we do, it is actually good to fortify their food or their meals with vitamin A sources, not just carrots, leafy vegetables,
Okay. Okay.
potatoes, sweet potatoes are a good source of vitamin A.
I like those.
Liver, if you can afford liver, palm oil, you know.
All right.
Yes.
All right. Very interesting. We actually need to run. We'll talk on the other side of this, but we need to run right now. Thank you all so
Thank
much for
you.
joining us, and thank you so much, Dr. Chidinma Nwokedi-Onyejekwe, for joining me this morning. Of course, joining Lagos this morning to
Thank
spread
you.
this
Thank
knowledge.
you,
It was a pleasure
Smooth.
having you.
Yeah, thank you, Aya. Thank you, Smooth. It was a nice time here.
All right, all our listeners, thanks for all the messages. Lagos Talks, Smooth 98.1, the Smooth Breakfast will continue. There's more great music lined up for you to get you started on your workday on a Feel Good Friday morning as the weekend is upon us. Stay with us.
Thank you so much.
It's a wrap. I need to stop the live because I sometimes forget to do that. And then anything you say can and will be used against you.